Welcome to the Total Health Channel, and thank you for being with us from time to time. Look forward to sharing with you on the topic of health today, real health care, as opposed to medical care, which is really bondage. Freedom is taking care of ourselves so we don't need doctor visits, tests, which are expensive, and adverse drug reactions, which are even more expensive on the body. We sometimes figure that, oh, that's for the other guy. It wouldn't happen to me. But after losing my wife to an antibiotic prescription that she took for 3 days and then didn't need it anymore, but adverse drug reaction wiped out her platelets, and she was referred to a hematologist who did a bone marrow exam in the hospital, then took out her spleen, treated her with high steroids and transfusions till she died of a stroke. And I've talked with other doctors who had similar experiences. Interesting. One said that made him deathly sick. Another was in bed for 9 months after taking the same antibiotic with another drug at the same time, both toxic. Anyway, and these are doctors that got sick as well. So problem is, the definition of an adverse drug reaction is properly prescribed and administered, not an overdose and not a bad prescription. It is commonly prescribed for that condition. But some people will react, and you cannot always predict who. I'd like you to hear this Dr. Peter, a Denmark physician and professor, who it's hard to hear him, but I want to play the video and it'll record. Just listen carefully. Turn up your volume.
Peter Gøtzsche. I'm a director of the Nordic Cochrane Center in Copenhagen, a professor of research design and analysis at the University of Copenhagen. 2 years ago, I found out that our prescription drugs are the third leading cause of death after heart disease and cancer. Our drugs kill around 200,000 people in America every year, and half of these people die while they do what their doctors told them. So they die because of the side effects. The other half die because of errors. And it's often the doctors that make the errors, because any drug may come with 20, 30, or 40 warnings, contraindications, precautions, and so on. No doctor in the world knows about all this. So they give patients drugs that they should not have given them, that interact dangerously with other drugs or food items or so on. And then the patients die. That's the other half. So the other thing I found out 2 years ago was that much of what the drug industry does fulfills the criteria for organized crime in U.S. law. And they behave in many ways like the mafia does. They corrupt everyone they can corrupt. They have bought every type of person, even including ministers of health in some countries. So there is a huge amount of corruption. In my country, for example, Denmark, we are regarded as having very little corruption. But yet we have thousands of doctors on industry payroll, although we are just 20,000 doctors.
I personally experienced what he is saying when I went through the U.S. Senate offices with medical literature to prove that medical care is really number one. He said number three. Let me tell you an update. He probably did. He may have been familiar with the JAMA, Journal of American Medical Association, on April 15, 1998, reported 106,000 deaths to people in hospitals under monitored conditions that died from adverse drug reactions. And the idea or the definition of an adverse drug reaction is properly prescribed and administered, not an overdose, not a bad prescription, as I mentioned earlier. But the point is that when I shared this information with, I've got to tell you the other information. That was in hospitals, and 2 years later, the Western Journal of Medicine on June of 2000 reported 199,000 deaths outside the hospitals as an outpatient study. And it included also not just deaths, but diseases that were, high cost, etc., costing an equivalent of what diabetic care would be, or, nationally or internationally. And then if you add those two together, 106,000 in hospitals, 199,000 outside the hospitals. 305,000 deaths is number 3 cause of death back in the year 2000. And that's not all. Actually, during that same time, a 7-year study was going on from 1998 to 2005, reported in the Archives of Internal Medicine in October 9, 2007. And I heard it on the news, evening news, TV, okay? So it was mainstream at that point, very concerned about why deaths and bad reactions are occurring from drugs. But as a result of that concern, no more studies. They're not reporting, they're not wanting to report, and the media is not reporting anymore because the media gets the drug ads from the TV. If you listen to the ads between one news event and another, it's horrendous about what's happening, and warnings though about if you have this or this or this, tell your doctor. Well, he can't keep track of them all, and bottom line is that it's more dangerous than you realize. It's really, prescription drugs are the most dangerous thing you can put in your mouth, and I'm including alcohol, tobacco, drugs. Actually, we are a drugged nation in bondage to what we think is good for our symptoms, but not so. I want to talk about real freedom, and it involves real health care, which could be quickly summarized by avoidance of the bad things like we've been talking about, and good diet and exercise as the 2 main ingredients. Sleep, fresh air, sunshine, other things are important as well. But most people somehow early in life, maybe it's because a rebellious teenager wants to go against what mom or dad told them, and so they in their rebellion they take a smoke or a drink or something, and then they get hooked for life. And I had a son that's dying now after probably many years of alcohol, tobacco, etc. And they're sorry, and but they don't know how to give it up. And I'm going to help you in this video toward freedom by recognizing that Dr. Pavlov, a famous Russian scientist, called coffee bad habit glue. It glues our bad habits together. And we can do better with that if we somehow will break away from it. I helped in a stop smoking programs when I was a medical student and early physician. We did a 5-day plan at the University of Arizona with 150 people approximately in the course. And on the last night, the 5th night, we asked how many had had a smoke in the previous 24 hours. And about 100 raised their hands that had not had a smoke. About 2/3 really, commonly, or 3/4 of people who attend these programs and do the steps that are told are able to break the habit and be free. And the situation is, and I'm just going to help you in this because the 5-day program has ingredients that will help break any habit, not just tobacco. If you're addicted to caffeine, for example, and by the way, it's almost impossible to quit smoking if you're drinking much coffee, because caffeine gears your nerves up, nicotine gears it down, and together they keep you in balance, so to speak. They go together like peaches and cream. And if you try to quit smoking and are still drinking coffee or Cokes, I wouldn't bet on it. I had a good friend, a neighbor, who wanted to quit, serious about it, thought he could do it, but having caffeine and other maybe alcohol, I don't know, but he's still smoking basically. Sad for the situation when a person goes to the trouble and needs to quit. Really, medically, it's a time bomb. It's been said that tobacco is a loaded weapon, and time pulls the trigger. So not good. And you can do it. You can break it. I'm going to explain the ingredients of this stop smoking program. Number 1 is choice. If I were to offer you $1 million to quit smoking, you would probably find a way to get it done, okay? Because it's motivation and choice. And if you really want it badly enough, you can do it. But when nobody's handing you $1,000,000 and you're feeling so lousy, you just want one smoke, okay? Well, one smoke is the whole habit. If you smoke that cigarette, you'll smoke again and again and again. But if you can stall it off, the urge to smoke is brief, like the urge to go to the bathroom. You can, when you suddenly notice that you need to go to the bathroom, you can stall it off. Say, I can't go right now, and it'll wait for 10 minutes maybe, or 20. The idea is that sooner or later your bladder really does have to empty, but you do not ultimately have to smoke. You can stall it off and have a strategy so that when you have the craving to smoke, repeat your choice. I choose not to smoke. This is between you and God, maybe. God, our body is His temple, and we want to live well. If we destroy His temple, the Bible says that it's not a good destiny for us, okay? We want to be clean and free, and He offers us help, and He'll offer you help in this situation, basically. So repeat your choice and say, God help me. Call a buddy maybe who's not a smoking buddy, but someone who wants to see you quit, maybe a spouse. Anyway, bottom line is repeat your choice and then stall for time for a few minutes, because that craving will dissipate and get less and less. If you don't smoke, take some lung exercises. Take some real deep breaths, as deep as you can breathe, and suck it in until you can't suck any more air out, and then blow it out, and blow it out until you can't blow any more air out, until you just squeeze it, squeeze it, squeeze it. That's actually excellent exercise for lung and your adrenal glands, which are sitting on top of your kidneys, and when your diaphragm goes down, it mashes those adrenal glands and squirts out a little juice, a little hormone that helps you cope with stress, okay? That's why they tell public speakers to take some deep breaths before they get up to speak. But it will help you to ease out of the craving to smoke if you take some deep breaths. Or go around the block, take a walk, brisk walk, sunshine, fresh air, nice idea. Or to the drinking fountain if you're at work and can't get outside maybe. But around the block if you're at home. Pick a time like Thursday night to quit, okay, where you only have one day of work. Tough it out with no smoking. And by the way, do not try to taper off. Tapering won't work. It's like cutting the tail off of a dog 1 inch at a time. And it does not work for you. But cold turkey all the way. And I know a internist physician and a wife pathologist who recommended fasting for the first day. It intensifies your willpower, and the thing is that food tends to stimulate the brain and take the brain, the blood from the blood goes to your stomach if you eat instead of your brain, and you don't have the willpower that you had as if you were fasting. Have you ever noticed that after a meal is when you want to smoke? Okay, that's one of the key times. Well, if you don't eat, you're off to a great start, okay? And the founders of the 5-day plan recommended juice, fruit juices, instead of alcohol. And alcohol is another reason you do not want to quit. You don't want to use that while quitting. And when you quit the alcohol as well. These are bad habits you don't need, and they will sooner or later kill you. So, and I'm saying this now as someone who, this stop smoking program that I did and helped with back in the early 70s, that was, 60 years-ish ago, basically. And I would just say, I'm in still great health. I'm in my 80s, and you can do it too. But the diet is helpful to go light on the high cholesterol, high fat stuff. High fat makes your blood sticky, makes your blood pressure go up, makes you it blocks the insulin receptors, so that the real problem with diabetes is not too much sugar or carbohydrate, it's too much fat for the most part. Type 2 diabetes can be cured easily on a low-fat diet and exercise. I had a nurse helping me back in Chattanooga where I was there, and she was a type 1 diabetic, had a kidney transplant from her sister, and took 80 units of insulin a day, but got that down to 18 units on a low-fat diet and walking as exercise. Dr. Caldwell Esselstyn, cardiologist at the Mayo Clinic, tells how that most diseases can be reversed without prescription drugs. And diet is a key part. It's what I'm telling you. His testimony is in a video that I offer in my book, How It All Ends. And the book, the video is free with a link on it. And if you get my book, I'll tell you at the end. I'm forgetting how much time I've got here. It's looks like I forgot to. Well, hold on. I got it here. Okay, there we are. 16 minutes, so I got still plenty of time. My website is 3 words everybody wants: healthhappinessdestiny.com. And in the book, How It All Ends, in the early part, there's a link. If you get the digital copy from Kindle, you can just click on that link and it shows you the video. If you get the printout copy, you have to type it in. But anyway, the book has it available. High value, because really prescription drugs cost you more than thousands of dollars over a lifetime of taking them. They cost your life as well in shortness of time. And you never know when they might react with something else that you take, because when you start one, you're on a slippery slope. So I just wanted to share that perspective. And the diet that it talks about is really a diet that I adopted mostly as a high school student. I grew up frying my own eggs and hamburgers and finishing off a half-gallon of ice cream with the family. But in high school, I changed my diet to become a vegetarian. And I've lived that way most of my life, basically. It's been many, many years since I had a taste of hamburger or chicken, for that matter. Basically, I'm married to a woman who has food allergies, and we maybe once a week have some fish, but it's pretty nice to have salmon sometimes. But I would just say that vegetables and fruits and whole grains and nuts have all that we need for the most part in a balanced diet. You might not think so, but when I was on a renal service in internal medicine, and these patients are having kidney failure, they can't handle high protein. They need low protein, but plain potatoes, have enough protein for them. You think, well, that's all starch. No, not all starch. There's protein in potatoes. And greens. A cup of cooked greens, whether it's kale, collards, mustard greens, spinach, has more protein than a cup of hamburger. Okay? Isn't that something? Who would believe it? But it's true. And it's high quality protein compared to the hamburger, in my opinion. And interestingly enough, the British Medical Journal recently reported that about 580 healthcare workers who got the epidemic virus type thing that we've been dealing with the past few years, those who had a plant-based diet or vegan diet had 73% less severity than their cohorts who weren't on that kind of diet. So I would just say, hey, God designed the body, and he put the plant foods here for us and our substance. And when man added meat to his diet, the lifespan shortened dramatically. When they came out of the ark, there was nothing to eat but sacrifice the animals, I guess. And so meat shortened man's life, so he would maybe in a shorter lifetime he would be involved in less trouble and sin. I don't know. But anyway, that's what seems to be the truth of the matter as we look at it. Well, I think that I'm in great health, not only because of diet, but because until recently I lived at a place where there was a hill behind our house, and I would jog up it periodically. I think jogging is good. I knew a woman, an octogenarian, who took up jogging then and climbed Mount Whitney, the highest mountain in continental United States, on a regular basis. Exercise is great, and it helps us sleep better. It helps our nerves. By the way, before I get out of this whole situation, I want to tell you how bad coffee or caffeine might be. You know, they try to make it look like it's good for your health, good for your mental. It's baloney, okay? Because I wish I had now a $10 bill for every patient I've seen who needed something for their nerves. They were anxious, etc., wanted something to calm their nerves down, and I would ask them, how much coffee do you drink? Well, yeah, they drank a lot of coffee. And the same problem, often people want a prescription for something to help them sleep. Okay, real good sleep is difficult when a person is drinking coffee on a regular basis. So that's just two things. My daughter got breast lumps when she was working the hospital at night, couldn't stay awake, drank Cokes, and her doctor told her they were not malignant, they were fibrocystic breast disease. He told her to quit the caffeine, and they went away when she did that. I took a year of cardiology training, and it was not allowed, coffee or caffeine was not allowed in the coronary care unit, because in the context of a heart attack, it could trigger a fatal arrhythmia. It does stimulate extra heartbeats. We call them PVCs, premature ventricular contractions, etc. You've seen these pictures of little kids with a scar in the middle of their upper lip. They call it hair lip, and sometimes they have a cleft palate defect as well, and they have a pronunciation difficulty with some words. This is an appeal for you to help with a surgery, but they're masking the idea that this is just a bad misfortune. Really, that mother in her first trimester of pregnancy was drinking too much caffeine. That's linked to that. It's been found to be a fact in medical research, and they should just tell you, cut out the caffeine, for heaven's sake. You know, and alcohol, caffeine. In a study with alcoholics, they found that they gave actually rats a choice between, I'm running out of time, between alcohol or water to drink, and they usually, on a laboratory chow that was nutritious, they preferred water. But if they gave a teenage diet that was pretty poor, high in sugar, they tended to prefer more alcohol, and if they added coffee and 11 spices, the alcohol consumption soared with the coffee, etc. So alcoholics, so often Alcoholics Anonymous, they get together and talk about their experiences, but they often they smoke while they're doing it. Bad idea. Bad habits, get rid of them all. God wants us clean, and for His sake, not just get rid of one. It's harder to get rid of just one, like smoking or coffee, than it is the whole works. Repent, God help me, etc. So I'd like to encourage you to go to my website, healthhappinessdestiny.com, and take a look at the video there, and get a copy, either digital or the other. It's a price that everybody can afford. You pay that much when you go out for a meal sometime, and a meal for your mind that's going to help you for the rest of your life isn't that worth it? I think so. You're worth it. So let me encourage you to pray, ask God for help daily, and health is, that's how Christ spent His time, helping people that way mostly. Less time preaching, but we'll preach too. We'll talk about other things next time, but thank you very much for being with us. Please share this with somebody that you know that needs it, and we'll talk later. Bye-bye.